Have you or someone you know ever had an electroencephalogram? If not, chances are you don't know what one is. An electroencephalogram, or an EEG, is a test that measures and records electrical activity produced by the brain. The first step in determining whether or not a person might need an EEG is to visit with a doctor who is specially trained to diagnose and treat disorders affecting the nervous system. This kind of doctor is called a neurologist. If the neurologist decides that an EEG is necessary, it can help signify or rule out certain conditions. Some of these conditions include seizure disorders, such as epilepsy. Epilepsy is a neurological disorder that affects the nervous system. Another condition is loss of consciousness or dementia. An EEG is helpful in determining the chances of a patient's recovery after a change in consciousness. EEGs are able to conclude if a person is in a coma. A person that is in a coma is brain dead. They also help to diagnose sleep disorders such as narcolepsy, as well as physical problems with the brain, the spinal cord, or the nervous system, and mental disorders. The administration of an EEG can be done in a hospital or in a doctor's office by a trained technologist. There may be some certain instructions that are given prior to an EEG, such as no medication, no caffeine, make sure that the hair is washed thoroughly prior to arriving, but don't use conditioner, gel, or other hair care products. In the case of a sleep-deprived EEG, the patient would be asked to stay awake through the night prior to arriving at their appointment. When the patient arrives at the EEG, the technologist will situate the patient in a bed or in a recliner. This allows the technologist to have easier access to the top of the patient's head. The technologist will apply the electrodes that go from the patient's head to the computer. When the technologist starts the EEG, the recording starts the recording, and the recording will show up on the computer screen where the technologist can monitor during the test. As a side note, there's virtually no pain or discomfort involved in an EEG. During the test, there are three methods that the technologist will use to induce seizures. These are used by the neurologist as he reviews the EEG to analyze. I mentioned earlier sleep deprivation. This is the first method. The second method is photostimulation. This is done by putting a strobe light in front of the patient's eyes, and it helps to establish if the patient has photosensitive epilepsy. The third method is hyperventilation, by taking deep breaths in and out for 3 to 5 minutes. And in younger children, this is best accomplished by having them blow on a pinwheel. When the EEG is finished, the patient is allowed to leave. They're disconnected and allowed to leave and then return at a later date to review the results of the test with the doctor. Now, when you or I look at an EEG recording, it may just look like a bunch of squiggly lines. But to the doctor, he's trained to read the recording and to determine whether or not there is a seizure disorder. In the case of a confirmed seizure disorder, the doctor may prescribe anti-seizure medication and then monitor that treatment through periodic office visits with the patient. In some cases, neurologists may order additional testing, even though the EEG has been done. This is because the tests, different tests tell different things about the brain. The EEG is the best way to monitor the brain waves, but it does not give an accurate picture of the inside of the brain. So if the neurologist decides that he would like a better picture of the inside of the brain, he may order an MRI or a CAT scan. Both of these are excellent tests to be able to see what's going on inside of the brain. And in the case that an MRI or a CAT scan is ordered, it can help clarify the brain's functioning. If you suspect that you or someone you know is experiencing seizures, it's really important that you visit a neurologist. The neurologist can help you determine whether or not you need to have an EEG. They can help you schedule an appointment to have an EEG administered to you, and they can review the results of the EEG with you, and if necessary, discuss possible treatment.